Hello everybody, it's Dr. Lindeman again with Lindeman Chiropractic. Last time we talked, we spoke a little bit about shoulder issues, and I'm going to go along with that theme a little bit today and talk about thoracic outlet syndrome. What the thoracic outlet is, basically, is a triangle formed of a bunch of different structures that exist right between the neck and the thoracic spine or the shoulder. Some of the structures that form this triangle basically is the clavicle. You have your first rib, which sits down in between there. It's a pretty small rib, it's about that big, but it sits right back in there. Scalene muscles that come up into the neck, which help raise and lower your ribs when you breathe in, help you turn your head. Sternocleidomastoid is another muscle that helps you turn your head. And then a little bit lower, you have the muscles of the shoulder girdle. You have pec major, pec minor, things like that. The thoracic outlet is this triangle, and basically the body, what it's trying to do is to make it simpler. So you have a tree trunk that goes through the thoracic outlet, and then it spreads apart. What's in this tree trunk is basically a bundle of nerves that comes down through the hole and then spreads apart as you come down your arm. Same thing with blood vessels. You have big blood vessels that come down and then they spread apart as you come down the arm. So, as you can imagine, this triangle is a pretty important structure. If anything in this triangular space is compressed, it can compress the tree trunk to all those branches. What I mean by that is, let's say you have an elevated first rib, or you have a spasm in the scalene muscles, or bad posture where the shoulders are coming forward, or a combination of these, which is more often the case. It can compress the thoracic outlet, and that can cause pain here, but more often than that, it can actually cause symptoms anywhere down the arm. With thoracic outlet syndrome, you can have numbness in your hands, tingling in the hands, weakness in the arm. You can have decreased blood circulation. Hands can be a lot colder on one side versus the other. You can have different kind of pain syndromes where you have muscle pain, anything like that. But with that structure being closed down, it really irritates all the nerves and function of the entire arm. So we've had patients that have come in with carpal tunnel symptoms that have been evaluated for carpal tunnel, and you don't have carpal tunnel, but they're like, well, it tingles in these fingers, it's carpal tunnel. Well, you can have compression here and still cause carpal tunnel type symptoms. Or you can even have compression in both places, in the carpal tunnel, in the thoracic outlet, and even in the elbow. So it's a good idea to get those all evaluated if you're having symptoms like that. Pretty common with thoracic outlet syndrome is, again, same theme, poor posture, shoulder coming forward into your head carriage, typing a lot, anything that brings your arms forward like this can cause compression in there. So a couple things you can do at home to help treat this, which is pretty good for anybody, is to do some stretches. Scalene stretch, the scalenes actually come up, they spread apart basically like a V, where the blood vessels and arteries and the nerves, come right between that V. So a good stretch for that is if you tip your head to the left. Let's say I'm trying to stretch the right side. Tip your head to the left, bring your arm, do that, and you can kind of reach down with your right arm here. That'll pull the scalenes down. You should feel a pull, but not pain. There's always a difference between stretching and pain. Some people think, well, if it's a little bit of a stretch here, if I really force it, it'll be better, but that's not a good idea. You always want to move slow into it. Same thing, one other thing you can do is put the arm behind your back, pull toward, if you're using your right arm, let's say, you pull your right arm towards your left hip, bring your head and tip it to that left side again there, and that'll stretch that. Another thing you can do is take your arm, bring it out to the side of you, and some people, if you have thoracic outlet, this is a test, you bring your arm up and you turn your head and it'll cause some tingling. So one thing that can work with that is to stretch, is to bring your arm up, turn your head a little bit and just try and stretch. Pull your arm like you're reaching for something that you can't quite get. That'll help kind of stretch some of those. But even more important is have yourself evaluated by a chiropractor, physical therapist, or your primary care physician to look for any imbalances here. What can happen pretty consistently, pretty commonly, and I find in my office, is the first rib can be an area of elevation. If the spine in the back is misaligned or rotated, the first rib can elevate or it can compress and can cause issues there. Same thing with the shoulder girdle, and like we said, follow it all the way down to make sure there's no impression there. The elbow and the wrist. Cervical spine can play a major role too. So a little bit about thoracic outlet syndrome or thoracic outlet, and we'll talk again soon. Thank you and have a great day.